Thanks everyone for coming today. I'll just wait a few more minutes till the attendee list goes up a bit further. Thanks people for coming. I'm just going to wait another minute or two to let the attendee list come up a little bit further before we start. I think the numbers have started to stabilise, so we'll just make a start and then people can join in and catch up when they're arriving. So thanks everyone for coming to the IHW Morris Block seminar. I'm Ruth Dundas. I work at SPHSU and I'm co-chair of the data science research team. And today we've got Richard Reeve speaking to us, and it's great that Richard's able to come and talk to us. He's a reader in the Institute of Biodiversity, Animal Health and Comparative Medicine, and he's co-director of the Boydor Centre for Population and Ecosystem Health. His background is in mathematics and artificial intelligence, and as a mathematical modeller, he develops analytical techniques in a variety of areas across the life sciences, particularly in vaccine selection for disease control and also biodiversity measurement for the study of ecosystem change. And both of these require the analysis of extensive and often inconsistently collected data. Since May 2020, so just over a year ago, he's led the Scottish COVID-19 Response Consortium, and that was part of the Royal Society's Rapid Assistance for Modelling the Pandemic. And in that short space of time, Richard successfully brought together a large number of academics, researchers and software engineers to adapt existing large-scale animal disease models to assess the different potential medium and long-term strategies for controlling the COVID-19 epidemic in the UK. And today he's going to talk about the need for open and transparent modelling for policy advice in epidemiology and also beyond. So thanks again, Richard, for coming, and I'll just let you start.
Thanks, Ruth. This is sorry. This is going to be a little bit of a rant, I guess, maybe. but also hopefully interesting about some of the issues that have cropped up in the last year that have actually been bugging me for years in the work I've been doing. So what I'm going to do is talk briefly about that work, the kind of mythical time before the pandemic, what I used to do, and then very briefly about some of the COVID work we've been doing. And then I'm going to talk about the issue that I'm particularly focused on here, and how we think it can possibly be fixed. So the last 15 years since I moved into the life sciences, I've been working on a variety of topics, but especially modeling antigenic change in influenza as we update it, update vaccines to combat it every flu season, every winter. And so I'm going to talk a bit about why we're doing that and what exactly we're doing there. So the WHO hold vaccine composition meetings every six months to decide the composition of the seasonal flu jab in the Northern Hemisphere and the Southern Hemisphere alternately. And they produce these recommendations suggesting 4 strains that should go into the flu jab, one for H1N1, one for H3N2, and 2 strains for influenza B. And to take H3 as an example, over the 26 years to a couple of years ago, over the 46 years to a couple of years ago since the introduction of H3 into humans, there were 26 updates to the vaccine. So this virus varies very quickly antigenically to escape human immune pressure to a large extent, and in a way that's quite different from how bird flu evolves in wild bird populations. And as a result, we're constantly having to choose new strains to go into the vaccine to cope with the current circulating strains. The WHO collaborating centers themselves generate huge amounts of sequence and serology data to determine how the virus is evolving. And as a result, they know what's happening today, or indeed for the winter flu season this year, they knew what was happening on the 1st of February. Which is when they started holding their meetings to determine what would go into the flu jab this winter, because it takes 9 months to manufacture enough of the vaccine to cover the whole of the Northern Hemisphere. And so they need to know what's going to be happening in 9 months' time in order to determine what should be the strain that they recommend to go into the flu jab. And we contribute analyses to these meetings. So what do we do in particular? Well, we get lots of the data as well as the sequence data. There's a lot of lab work that goes in to identify which vaccines that they're testing will neutralize or will hemagglutinate inhibit hemagglutination in the viruses that are currently circulating. And this work was originally done in the National Institute of Medical Research down in Mill Hill in London, pictured there, now in the Crick Institute for Europe, that is. But the other collaborating centers are situated around the world. So we use those data, the sequence data and the serology data, to identify these blobs, which are the places where we think major antigenic change occurred, and the different color schemes are for show viruses that are phenotypically different, so that they require different vaccines for you to be protected against them. And we look at the phylogeny of these viruses, and we've colored it as the sequence changes occurred. And so these are different clades in different colors here, and we identify which of those are actually significant, which are major variants. And so this was as of last year, as of 2 years ago now. I always lose track of what year I'm in. And we can see that this strain here was beginning to emerge as an antigenically distinct virus from the circulating strains from a couple of years earlier, and that was quite concerning. And then back here there's another change, and back here there was another change. So you can see every couple of years the viruses are changing enough that they warrant an update to the vaccine. And what we then try and do is to identify, to predict which strains are going to take off over the next 9 months. So this is what we're trying to do here, is predict what's going to happen here. And we're predicting here that that this 333A clade is going to take off from the vertical line where we currently was the date at which we were trying to do the predictions. And then using that information, we try to predict how good these different candidate vaccines will do against the strains that we think will be circulating in 9 months' time. And as you can see, we're predicting that all of the vaccines will do worse for that year over time, and that's not entirely surprising, but some of them will do significantly worse than others. So this one is tuned to a clade that's dying out, we think. Whereas these ones are just slightly, are doing slightly worse than they were originally. So we would obviously be suggesting using the A Victoria strain here. So that's what's gone in for the last 5 years into these reports. And what are we doing this with? Well, we're doing it with just spreadsheets. We just get sent spreadsheet after spreadsheet after spreadsheet, and we get sent hundreds and hundreds of spreadsheets. And this is going to be a bit of a recurring theme, that we're trying to manage these data, and the data is just a mess. And that's, with the greatest respect to the people generating the data, it's very hard when you're doing all of these different assays from all of these different laboratories in all of these different ways with different kinds of data, with different assays that they're running, then inevitably the data becomes very hard to manage. And we're doing this with a huge number of different groups, with the different collaborating centers, and they're doing a fantastic job, and they're analyzing all this stuff themselves, obviously, to understand exactly what's going on. But one of our, one of the things that really hits us every year is coping with the influx of new data and coping with managing the data flows through our system to make sure we're definitely using the right data, it's cleaned correctly, it's managed correctly, and everything, and so the conclusions that come out of our analyses are valid. So just going to very briefly talk about foot-and-mouth disease, where we have a similar problem, talk briefly about why we're doing it and what we're doing. So FAO in this case, rather than WHO, want to be able to simplify manufacturer requirements for vaccine testing, for vaccine production, because they want to be able to make it easier for vaccine manufacturers to manufacture appropriate strains for circulating strains around the world. Because there's less movement of cattle than there is movement of humans, we see many more strains in different parts of the world for foot-and-mouth disease. So it's a more complex picture. And they also want to provide guidance to governments and individuals who want to purchase batches of vaccine to help them identify what the correct vaccine will be to buy for their particular situation in their country with the current circulating strains that have been identified. And this is particularly important because at the beginning of last year, perhaps very poorly timed given the start of the pandemic, there was a big push to manufacture new vaccine strains for East Africa. At the moment, there are almost none, and there are essentially no vaccine strains that we entirely trust that are available in East Africa. So a big prize was put together, $17, $18 million at the time, was a huge amount of money for vaccines. Obviously these days it's pennies, but this was last year. And so they wanted to be able to provide the best possible advice. And so as a result, we set up an expert group for FAO on vaccine selection. And this isn't a hugely complicated picture here, but there are 3 different things that we need to care about for vaccine selection. It's how good is the vaccine in and of itself, how efficacious is it, how potent is it, how well matched is it to the circulating strains, and this is the same issue as we've seen for flu. So for flu, we kind of know how to manufacture good flu vaccines, and so this isn't really an issue. For flu, this is an issue, but it's a global issue. For foot-and-mouth disease, it's a local issue. Is it matched to the strains circulating in my country? Because the disease will walk across the country at a few kilometers a day, won't sweep across the country with cars to the same extent than flights to the same extent that flu does. And then vaccination schedule becomes very important. And this is something that we're hitting with COVID now, even though, we've got concerns about potency. We don't really have concerns about match yet, although that's beginning to arise with this new Delta strain for COVID. But vaccination schedule has obviously been a massive issue over the last year. And it's also a big issue for foot-and-mouth disease. So what are we doing? We're looking in the different countries and we're identifying what strains are circulating. And these are different serotypes of foot and mouth disease, totally antigenically distinct strains in different colors. So you can see these waves coming backwards and forwards through this area over the years. So this is one particular area of Northern Africa, Northern Tanzania that we were looking at. And you can see these waves coming through. And so at this point, we really need a, I can't remember what purple is, but we need a purple vaccine. And we go out into the communities, in fact, and we talk to them about kind of color matching of vaccines and things like this. It's very interesting trying to understand what the constraints are that they're operating under. But you know, there's a big problem with collecting the data here, because these are remote rural communities that we're working in. And so again, the data is a real problem. And we end up with a picture a bit like the phylogeny I showed you before. This is drawn differently, but the different colors here correspond to, this is one of the serotypes of foot and mouth disease. The different colors correspond to different phenotypes for the disease for the virus that you're not protected one against the other. So we see this purple strain appearing in a few places where genetically they're quite different, but actually the vaccine will protect against all of them. And then there's the potency issue, and we get a lot of very good vaccines, which is great, but we get a long tail of poor vaccines that aren't very good. And this is obviously a concern with some of the manufacturers for COVID vaccines too. So we're having to piece together all of these stories here. And again, and finally, we have this vaccine schedule issue that if you leave it too long before the second vaccination, and this is a kind of 6-month window they're looking at here, that they recommend a prime and boost within a month here, which was what was originally scheduled for the COVID vaccines, obviously, and then a revaccination every 6 months. Otherwise, the protection starts to drop off the protection starts to drop off quite quickly with foot and mouth disease vaccines. And this is something that's going to be of serious concern over the coming months for COVID. And again, this is work that we've done with large numbers of groups. But again, what's really hitting us here is just the diversity of data that's coming in. We're always dealing with data that's coming from different countries, coming from different groups, coming from different labs, and it's always a new data set, and just managing the data it proves to be a really tricky task, and we don't have a huge amount of support to do that, which is a matter of constant frustration to us. And just to say, this isn't all disease work. We also work on biodiversity modeling, population ecosystem health. It does cover both angles. So we're looking at ecosystem health here and looking at how in particular, how plant biodiversity survives under climate change. So a bit of a change of theme. And we've been extracting data for hundreds of thousands of different plant species across the world, and then running simulations under different climate change scenarios to identify which areas of Africa, in this case, are under threat from climate change. And and we can successfully reconstruct a lot of the biodiversity hotspots using these models. It's far from perfect yet. And now we're going on to do this, focusing in on the UK with some NERC funding with the Natural History Museum and BIOS in Edinburgh, and to identify exactly what's going on in the UK and how badly we'll be impacted by, say, draining peat bogs. Have become a big issue recently. We're working with Peatland Action in Scotland and other groups around the UK to analyse what happens in this situation. And in the UK, we still have 1,800 plant species. We're running on a 1 kilometre grid to cover the whole of the UK, and we're looking at species interactions and dynamics, the different climate that the plants might be exposed to, but also land use types become really important in the UK. Obviously, it's not a natural environment by and large, and different soil types and all this kind of stuff to answer policy questions to do with, in particular, peatland and invasion of novel plant pathogens from overseas, or from, say, the south of the UK moving north as the climate warms up in Scotland. And there's a lot of complexity in this. I'm not going to go into this in a huge amount of detail. The website is there if anyone's really interested. But essentially we have that up and running now. There are 1,600 plant species that we've incorporated in this. A lot of the other ones are, say, aquatic species and things like that. And we have better data for Scotland than we do for the rest of the UK because it's better maintained, or at least we found it so. And we're running a lot of analyses on papers, in fact, so on taxonomic literature, to extract information that we need to parameterize all of these models with these thousands of species. And we intend to then take this back to a global scale, and we're going to be extracting information from hundreds of thousands of papers using natural language processing to interpret what the papers are saying about these different plant species. And this, again, is using up huge amounts of data. The actual plant records themselves, there are hundreds and hundreds of millions of plant records that we're extracting information from, generated again by tens of thousands of individuals and organizations who don't always have the same interpretation of what a plant record should look like. And we're getting these data from all sorts of places, from the climate modelers, the Met Office, for instance, CEH is obviously a big source of these kinds of data. And the European Centre for Medium Range Weather Forecasting kind of aggregates a lot of different European weather models. And then all of the plant data from the global GBIF, I can't remember what it stands for, my mind's gone blank. And lots of other sources of information, land cover information, all this kind of stuff. And so these data sets are being updated. GBIF is being updated daily. The climate models are updated more infrequently. The land cover data is updated more infrequently still, but nonetheless, these are huge numbers of data sets from all over the world. And this has been a big piece of work. Natural History Museum has obviously been critical in really understanding that, and the botanists down there have been fantastic. But again, we're really hit by problems with data sets. And so we come to COVID. And we set up this, there's a group of us who set up this consortium. There are a lot of people from health and wellbeing involved, and from the rest of Glasgow, but also EPIC, which is a consortium itself that runs the animal disease expert advice for the Scottish Government. So if this had been a bird flu outbreak or something, they'd be providing the government advice for this. And Biomathematics and Statistics Scotland over on the East Coast, they've been heavily involved in this as well. But we've actually brought in people from all around the UK. There have been a lot of organisations, a lot of universities from across Scotland and the rest of the UK, and then the biggest other organisation involved has been the UK Atomic Energy Authority, who've been fantastic in providing software engineers to help with this kind of work. So what we've been trying to do is to provide additional advice. So they're already, just as EPIC provides animal disease advice to the government, there are already groups that provide human disease advice. So we've been trying to think of ways of improving the quality of advice that can be provided, and providing services that perhaps the frontline modeling teams are too busy to have time to investigate. So we have an epidemiological model. This is pretty much what all of our models use. We kind of converged on this quite early on. There are a couple of tweaks to it in terms of how people implement it. It's often got age categories, obviously, because the disease progression is strongly influenced by age and gender differences as well. And we're also interested in lots of other factors. But this was our kind of core model, and then we had half a dozen different epidemiological models that take different approaches to how they model it. And this is quite typical of what the SPI-M groups and so on have done, that they have a variety of different models, and some of them provide very detailed local information. Some of them are very good at modeling how disease progresses inside hospitals or care homes or whatever. Some can hook into environmental and weather data, and so on. And so our different models up here can do a variety of these different things. For instance, this MVP model here. Well, hang on, sorry, I got slightly confused. But the problem is that the data needs here just never let up. It's just there's just always more problems with more data. The data is being updated, obviously, daily. And one thing that kept on hitting us is how can we be sure we're running off the most recent data for all of the different data sources that we're using? And we had this dream that, yes, fine, it's, we're only a couple of months into the pandemic at the time, and this is all a complete nightmare, but at some point in the near future, it'll all be lovely and relaxing, and we'll have a whole bunch of people working on the data, and everything will just be hunky-dory. Unfortunately, it never came to that. And a lot of that is because people consider the data side of things to be kind of unsexy. It was the conclusion we came to. There are lots of volunteers to help with the kind of modeling side, with designing the models, with we have a big visualization team who are fantastic, who've been doing really great work. But actually on the data side, it's been a real struggle to get people on board to help with that. And just to give you an idea of what that looks like, this BEEP-MVP model, the last of those models that comes out of work from Edinburgh and BIOS in particular, has so many different parts to it. I mean, this is just one part of the force of infection. This is just controlling the flow from susceptible individuals to exposed individuals in the model. And we have all of these different terms, the kind of effective reproduction number, effects for different strains, so the Delta strain being much more infectious than the original. It has effects of population density, temperature. It has mixing parameters that vary as lockdown eases and strengthens. Age mixing, which again varies depending on whether schools are open, schools are closed. Infectivity, there are population density related issues. And then there's control of our borders, external sources of information, sources of infection and things like this. So even in this one term that controls one part of this model, there are so many different data sets, so many of which are updating on a regular basis. And it has been, it would be fair to say, quite a nightmare. If you look now at the situation for data, it all looks quite nice. So there are, Google provides some data sets that all seem good from around the world. Our World in Data have done a great job of collating data. And then the UK government have useful information that is a kind of hybrid of the data that you might actually want to download to do your analyses and the data for the public to see what's going on in a kind of easily representable format. And I want to single out here actually Open Data Scotland, because a lot of this talk is about problems, but I just want to say Open Data Scotland are fantastic. Anybody involved, if it happens, anybody involved in this is here, then just fantastic people, and they've done an amazing job putting this together. They have easily searchable data sets. You look into them, you get these nice tables showing you what's going on with vaccination at the moment. You have data dictionaries with rich metadata that has kind of qualifier information to say what these categories are, and you can look into that, and there are more tables, and it's tables all the way down. The metadata is beautiful from the point of view of being able to understand exactly what's going on in your analyses. And so there are examples now of absolutely first-class data. But when we started this, it didn't look like that. And we were looking at data that really, it could have been, some of the data was literally being copied off Chinese newspapers, because that was the source of information they had at the time, and people phoning around hospitals in Italy to ask case numbers and things like that. The data was very difficult to understand, and very difficult to interpret, and very difficult to get a good feel for how trustworthy it was. And excuse me. And this has been a perennial problem for us during the pandemic, is that the data sources have been untrustworthy. And even those data sources I was talking about earlier, the Our World in Data and the the Google data sets in particular, it's still very hard to tell exactly where those data come from and what cleaning routines were done to analyze, to clean up the data to ensure that it's in good condition, and how comparable one country's data is with another country. A lot of that information is not deliberately, but it's masked in order to make it easier for you to download the data. And these are all problems when you want to provide advice to policymakers, and you're working with data and you don't know exactly what it is, you don't know exactly how clean it is, you don't know exactly how much you can trust it, but yet at the end of this, you want to be able to provide honest advice about what you think your best understanding of the situation is. And it's not just about the data. So I've already talked a bit about the data. I've jumped ahead a bit there, but there are also problems with the models. And I'm sure people remember early on there was a lot of criticism about the fact that the models that were being used in SPI-M and were being used for advice to SAGE were not open source, were not available. And this first commit was released on the 22nd of April, which was very quick, to be fair, from Imperial for their model. But the response to this was not the response you might initially have wished. And here we are a couple of weeks later saying, was this all just guesswork? And there was an enormous amount of criticism from software engineers about the quality of the code. Now, ultimately, a few weeks later, some rigorous analyses were done, and the conclusion was that model was reproducible. But I think we can probably all agree that we don't personally want an article in Nature calling our software a horrible and a buggy mess. So we've got two problems now rather than one. We've got a problem with how reproducible the code is, and we've got a problem with how trustworthy the data is. And a lot of these are kind of known software engineering problems, and there are existing solutions for them. So obviously, in the simplest case, we have an excellent research data management team in Glasgow. So there's work that can be done there, which is great, but it's fairly limited. There aren't very many of them, and they don't have huge amounts of resources. But if your data needs are relatively simple, then it's obviously a good starting point. But there are also tools for doing this kind of stuff, and in particular, there are tools related to Git, which we use for software control, software management, for managing data sets. So Git Annex allows you to manage large data sets, which Git doesn't naturally do very well. And then there are things built on top of this, like DVC for data version control, which allows you to manage data. I mean, they're talking about machine learning projects here. There's nothing particularly special about it that refers to machine learning. But what these tools allow you to do is to manage open data sets and to manage the code alongside them and to make the whole thing one coherent project where you're looking at the data, you're looking at the analyses, and you're producing the results, and it's all in one place, and that's fantastic. That's not the situation we're in, though, with a lot of our data sets, and certainly not with a lot of the COVID data, because of confidentiality issues. The data isn't open, but also because of issues to do with the data itself. If we have a stream of data coming in, we don't necessarily want all of our analyses to have to incorporate these data sets into their individual repositories as we go along. We want to just be able to say, give me the latest version of this data, and it will go away, look in some registry and say, okay, that's the latest version of this data. That's what I'm going to run in this model. And then it's going to record that those are the data that were used for that model run, so that when you come back to it later, you can see that that's what happened. And that's quite a different need from the need to manage an open data set with an open software, all in one place, all at one time. There are ways of looking at this that already exist to look at what you did in retrospect, so the research object team have been around for about 10 years or so, and they manage these kinds of problems. And they've recently come up with a research object crate, they call it, which is essentially a kind of zip file that contains all of the data that went in, all of the analysis you did, and all of the outputs, all of the figures and whatever the paper that you produced at the end, all in one place with metadata to explain what the connections are between things. And this puts all of that stuff together into one file that can have its own DOI, so that when you look at a paper, you don't just look at a paper, you look at all of the research content that went into that paper. But this is more of a kind of interoperability format than it is a solution. But nonetheless, it's an excellent step along the way to explain how to put all the pieces together. And this problem was identified a few times. Well, these problems to do with software reproducibility, model output reproducibility, and the data trustworthiness were identified a few times by different teams during the pandemic. And essentially 3 that we've really discovered were set up all around last April, May, of which we were one. So the first 2, this was a Microsoft project, hasn't moved forward very much recently, but this was to ensure really to focus on reproducibility, to focus on wrapping your model in a harness that made sure it did exactly the same thing each time. It wasn't really focused on the code, on the data that was going into it. It was really focused on the reproducibility of the analyses. And this is obviously a really important thing, that we can reproduce the results. But I think that it was too hard to use, and too it wasn't exactly what people were concerned about at the time. So there hasn't been much uptake from this. On the other extreme, an approach from Oxford, Open Safely, is now beginning to take off quite seriously for COVID modeling. And their approach was to really focus on the data, and in particular on how you handle the fact that the data is all in safe havens, but you want to operate in the outside world. And so this is led by Ben Goldacre of Bad Science fame, but it's very, very tightly focused on the ability to analyze NHS data. It's not designed for anything else. It doesn't work in any other context. But if you are trying to do an analysis that relies on NHS data, then it's an excellent way of taking this forward, to be able to do specific analyses using NHS data in a very safe way, and developing your code in the open, but doing the analyses in suitably secure environments. And so that's great, and it's very, very targeted for this specific problem. But as I think I've already explained, our problems are much broader than just NHS. And so we want to be able to provide a framework for doing analyses that don't care about the data, the exact type of data, whether this is data from your own lab, or it's data from NHS, or it's data from overseas, from FAO, from WHO, from wherever. We want to be able to manage this data well. And so the largest part of what we've been doing over the last year is to think about how we take the current situation and move it forward to generate open science tools. And so we've been thinking about about this for a long time, as well as the stuff that I've been describing myself. EPIC, this animal disease consortium, have been worrying about this for a long time for the Scottish Government. The Scottish Government itself has been concerned about this for these and other reasons. And so we've been worrying about how we do epidemiology in the open. And essentially the answer that we come up with is that you need to have some kind of scorecard to tell you how things are going. And I'm not going to talk about all of this. I've only got another 10 minutes. But essentially we came up with this scorecard for assessing model quality and data quality, and the connection between the two, and how policy ready the results of that are, and how we validate the models, and all this kind of stuff, to come up with a completed scorecard. So when we produce advice, the idea is we produce it alongside a document that explains how trustworthy this advice is and what data sources we used and all of this. So people who want to or are suspicious about our results can drill down into it and see exactly what we used and why. Yeah, so what we want is something that's reproducible. Yes, I mean, it comes first here, but it's probably not our principal focus. What we really want is for it to be traceable, so we know what we did, rather than that we know, rather than that somebody else can exactly reproduce it. We want it to be validated. We want the code and all the data processing and all the models and everything to be open source. But the data isn't necessarily going to be open. What we want from the data is that it's fair. And many of you will probably already have come across FAIR, but these are principles that are essentially about metadata. So it's saying that we want the data to be findable, accessible, interoperable, and reusable. And what this is really saying is that we want to be able to identify exactly what data we used, and we want the data to describe itself well enough that we understand what it is. And that's really where we're coming from here, that the data may not be available to other people, but at least other people can look at our kind of chain of custody and can see that these were the data sets that were used, and that's where they came from, and that's what they represented. And there have been in the past arguments that perhaps some data is so sensitive that even the metadata is sensitive. But I think our contention is that if it's so sensitive that even the metadata is sensitive, then should we really be collecting it at all? If I'm not even allowed to know that those data exist, then that worries me a bit about what exactly it is that you're talking about. So we feel quite strongly that all of the data that goes into these analyses should be fair, even if it's commercially confidential data, say some of Google's movement data might be, or data from Amazon or data from whoever. Nonetheless, we should know what it is they're providing us with. And so I'm just going to briefly talk about the tools we're producing for data model traceability and a little bit about the reproducible software. So one thing we did not want to do was to come up with a new standard because, well, XKCD really has this right, that we just don't want to be producing a 15th competing standard for this. And so, you know, we talk to people on the Open Data Institute who work on this stuff for a living, and all of the technologies already exist. So provenance, tracing who did what to whom over time, going back to the original raw data, those standards already exist. The World Wide Web Consortium have produced PROV, which explains how to do this correctly back in 2014, so it's quite old now. And so all of that's 2013 actually. So all of that is already out in the open, so we just adopt that. The metadata itself, W3C again have produced DCAT for explaining how to produce metadata that's easily accessible, that's fair. And Alejandro Gonzalez Beltran is part of our consortium doing that work for us to make sure we're using DCAT. And then we want to be reproducible. There's a lot of work, say from the Turing Institute, but lots and lots of others on reproducibility. So we take that on board, although, as I said, it's not principal focus. And so then we take all of these tools and we take the RO crate stuff that I mentioned earlier for the file formats, and we look inside. And what we want is something that for us as modelers is simple to implement. It improves access to data. It's not neutral. It actually makes things better for us. And it automatically updates data when we're provided with it. It improves code readability. And it allows us to check what's going on. For policymakers, it makes it easier for them to see what we're doing. And it makes clear where our outputs have come from. So when we provide them with outputs from our models, they can look back and see that we did this using recent data, not data from 3 months ago. They can easily check that, and they can query it, and they can understand. They can look at different models and compare what data sets they used. You know, we're not quite there with the tooling for that yet, but that's the idea that we'll be able to do. And together with all of the other stuff we're talking that I'm not talking about today, it provides an end-to-end open source validated traceable link through from the data through the models to the model outputs, so that we can connect directly the raw data we are using to come to our conclusions with the policy advice that we then provide. And I'm not going to go into the detail of the code here. I don't think it's quite the right forum, but I'm happy to talk to people about it because obviously we're keen to get people to use it. But we essentially have our data in lots of different places, not just one here, and a data registry that maintains lists of what data we know about, and then a bunch of models that use data from this data registry, and then a scorecarding system, which then goes into policy briefs and are provided alongside the policy brief. And if we go into that, we see a lot of technical detail to allow us essentially to run these things locally on our laptop or whatever, or inside a safe haven. Even though the data sets don't come from these places, the data sets don't come from my laptop, obviously. Also, some of the data sets we work with won't come from safe havens, even if we're working with safe haven data. And we want to be able to come up with a way of running these things offline, essentially, so that they can operate in any environment we like. And then we can synchronize the metadata back to a central registry that's open, this remote registry, even though the data itself may be prohibited from uploading to remote data repositories. And the idea is we have a really, really simple API, and all it does is allow you to wrap read and write calls. Anything in your code, so anything in your R code where you're reading a CSV file, you just say record this read whilst you read the CSV file. And anything where you're writing a CSV file, you say record this write while I'm writing a CSV file. And that with a little bit of extra metadata to explain what this run is all you need to do to make it as minimally intrusive as possible. So you call initialize, then you call record read, record write, and raise issue if there's a problem with one of the data sets, and then you call finalize, and then you're basically done. And so we want to make this as simple as possible for people to use. If we drill into this, there's actually lots of issues to do with the data management itself that Ruth Dundas was heavily involved in alongside people from BIOS, but I'm not going to talk about that. But there's lots of issues to do with where you find the people to manage the data and curate the data and so on. And these are all big issues that need resolved, but they're not technical issues in the same sense. So I'm just going to ignore them for now. But inside there, we have a data registry where you could just look the data up. And this is our current data registry. We're about to upgrade to a new version and wipe this data registry, but at the moment it still works. And here the hospital data. This is actually an image from a few months ago, so this is from November last year. But here's the hospital data, the care home data, the mortality data for SARS-CoV-2 for Scotland, for instance. And we drill into one of these. This is just the demographic data, and we can see all of the different views of this data. So we can see it broken down by Scottish parliamentary constituency and by age, and by gender, or by local authority, and so on and so forth. So different ways of viewing the same data set that you can access. And then you can drill into a specific one saying, okay, broken down by data zone, by age, and then by person, so not by gender. Then we have this data set and there are no issues associated with this. So we think this is good data on the current demographic makeup of Scotland by data zone. So yeah, and so we store all this stuff inside the schema that was. We spent a lot of time arguing about what the critical parts of this were, and what we end up with when we do a run using this recording API to help us, we end up with a trace of what called what during which code run, so during which analysis, what called what, and these get more complicated as we add more things into a single analysis. Eventually they get too complicated to really read. We're working on the visualization angle there, but when you zoom into it, then it does look pretty much the same, that you're doing this run with lots of different components that you're reading and writing and so on. And then from the code point of view, again, as I said, there's really very little in this API. So you basically, there's a bit of metadata saying these are the files I'm going to read, because you have to make sure you have them cached locally. And then you just call read array on this to read an array out, or you can call read CSV and then record read to say, I'm going to use my own tool for reading it, but I just want you to record that I did it. And so this is in Julia, but similar stuff exists in Java, in C++, in Python and R. And I don't have time to talk about reproducible software because my run through last time seemed to go a bit quicker. So, but suffice it to say, we've been thinking about ways of checking exactly how trustworthy the code is, and we have a checklist to ensure that the code all looks good. And that's basically it. So, I mean, the idea for this whole thing is to make it really easy for civilians, for random people who aren't expert coders, which was the problem with the Microsoft solution, to trace exactly what happened in their code, and to understand what data sets we use when and where and how, in a way that makes it easier for them to trace what they just did, and to understand, okay, if I want to reproduce this, then I need that data set because I know that that's the one that I used in this original analysis. And you can look to see what changed. If you get different results with a new analysis, you can see exactly which data sets changed and what changes happened to the code, because I haven't mentioned this, but it traces exactly what code you used when you were running the analysis as well. And so it does all of that for you. And this is work funded by STFC as part of a COVID rapid response call, but obviously the original work was RAMP funded. So I'm going to stop there. Sorry, I had to rush through the last bit because I totally misjudged how long I was going to take. But I hope that made sense.
That's great. Thanks, Richard, for that. We do have some questions in the Q&A box. So if anyone has any questions, please type them in the Q&A box. And we'll just start with this one from Yola Jones. She says, fantastic talk. I'm so glad someone is highlighting these issues, and it's definitely needed. However, I think researchers are often hesitant to add an extra step to their process. What do you think is the best way of communicating how important this is, and why should they care?
I mean, I think that's completely fair question. And it's something, so it wasn't something we were concerned about last May when we started this. We really just wanted something that did the job. But once we got funding for this year, it took quite a long time for all this to grind through. Once we got funding to work on this, and we talked to people about how, whether they would use it, how they would use it, and so on, we got a lot of feedback about the fact that really it needs to be useful to somebody. It needs to be obvious to somebody in the kind of first couple of minutes why this is going to be a useful thing to have. And it needs to provide them with something. It can't just be, your code must be reproducible, and it's impossible to do. It has to actually provide a useful function. And for us, what we're kind of homing in on here, and we're not there yet, is on the one side, make it really easy to use, so that you can get something out of it straight away. But on the other side, what's it actually doing for you on the data management side? So now we can run this registry locally on our own laptop or on our own desktop, and we can just use it to maintain our data. And we can look at a data set and say, do I know what this data set is? And we can just query it and say, what is this data set? And the metadata will be immediately available to us, because it will be able to identify the file, not from where it is on your file system or something, but by its checksum. So by an innate property of the file itself, to tell you exactly what it is you're looking at and where it came from, who did it, to whom, when, where, how, and all of that stuff. And then even what analyses have I used this for? And then you can, and so the idea is we'll be able to easily say, okay, what did I use in this analysis? And it will show me the files. And then what other analyses have I used this file for? And it will show me the analyses, and go backwards and forwards. And it'll give a different way of exploring what you're doing. And you'll be able to do the same with other people's data, obviously. And that's really what we want to do is to provide a tool that's a handy way of managing data for yourself that also provides all of this additional utility at very low cost. So there are two things that you have to do in order to get this to work. One is to provide this metadata that actually says what the data sets are, but at least now we're providing you with a place where it will be stored so that this isn't in some text file somewhere that you hope you don't lose. But the other thing is just these little wrappers around read and write commands. And that's the lowest kind of barrier of entry we could come up with in order to achieve this. So yeah, so I don't know whether that, I mean, I think that communicating the importance of it is maybe the wrong game to play, I suppose. That we think that it's really important. We think that policymakers will think it's really important, that they can understand what's going on if they want to. But I think the game to play with users is to say, look, don't worry about, accept that this is a vaguely useful thing, but actually it provides you with really useful short-term benefits that you can use today.
Okay, yeah, thanks for that one, Richard. This is going to be a bit tricky because it's a webinar and we can't see you. So wherever you are sitting, I'm just wanting to reflect on whether you think this is a useful process to go through. So it kind of links with Yola's question as well, like, why should we care? Richard and I think Yola as well, all seem to agree that it is a useful process. So I don't know how the best to canvass everybody, whether you put your hands up and we can see you. I mean, virtual hands on the Zoom, not your hands in the air because we can't actually physically see you. But it would just be useful to know if people are agreeing and do think this is a useful process and a step that isn't a step too far. It is a step that, people can go through. And, we are in the world of open science and open everything. And so therefore, we need to start thinking about opening things. So I think what Richard's providing, it's a small gate to go through, a small step to go through for big gains. Something I'd like to ask as Chair's prerogative is about the kind of data side and the data struggle. So you talked a lot about your kind of like current projects that you're working on, and then also the COVID one from last year about sort of struggling to get people to work on the actual data side of it. So I'm just wondering what you think the issues of that might be. So is it the data skills, people don't have the handling or the analysis skills? So is it a kind of like capacity issue? Or is it's not seen as something that's particularly interesting and exciting and people just want to get in and, do the modelling, whether that's the type of mathematical modelling you do, or whether it's more the kind of like statistical sort of analysis regression type models that we might do more of in IHW. I'm just wondering, do you think it's people want to do that side of it rather than the sort of slightly unsexy getting messy with data?
Yeah, I mean, I think that's exactly it. I mean, it's an interesting thing that I've observed over the years that I find it quite easy to find people to work with on the analytical side, PhD students, postdocs, collaborators, whatever. But I end up having to do an awful lot of the data cleaning myself because it's almost impossible to find somebody to volunteer to do it. And I think there's just very little appreciation of. I think there's very little credit given. I think is one of them. There's very little.
Yeah, I was wondering. Yeah, do you have any solutions then? So you think it is about credit? It is about maybe training? It is about career development or something? I think that one of the reasons why people don't see it as a very credit-worthy thing, perhaps, is that we're just short of. There's not really a good mechanism for, to put it bluntly, the kind of ref credit for having generated data rather than having come up with new hypotheses about the world. And so, I mean, almost all of what I do is totally dependent on tens and tens of collaborators and thousands or tens of thousands of people I don't even know who are generating the data. But yet they get very little credit for what I do, and that's wrong. And I think that one way of redressing that is to make it more explicit
what data we're using, that we write it into papers, but we often write it into papers in ways that make it very difficult to trace down what's happening. But if all of our work automatically produce provenance reports that said exactly what it was we used, then we'd be able to see these little nuggets of information that were being used over and over and over again, like the mixing matrices that have suddenly become incredibly sexy in the last year, understanding how people interact with one another. But I think that might even have been a +1 paper, because everybody said, oh, that's just too uninteresting for anyone to care about. But it's absolutely fundamental to our ability to control this pandemic. And I think that without really having some way of measuring use and understanding, it has to come from that direction. I think that there has to be credit given for it, and then people will suddenly realize how cool it is, rather than trying to force people into it, because, well, we've noticed that that's not very successful.
Thanks, Richard. Oh, we've got another question has just popped in. I was going to say it's 2 o'clock. So if people, I don't know whether, Richard, whether you're able to stay and answer this final question. Yeah. Okay, great, thanks. If people need to go, then please do go. Thanks everyone for coming, but we've got one question. If you can wait for that, that's also good. So we've got a question from Kate O'Donnell, and she asks, do you worry that some of the challenges around COVID modelling that have been very public is giving work like this a bad name? So it's making it seem sloppy when clearly the analysis isn't sloppy.
I mean, I think that it's completely reasonable. I don't think all the criticism was wrong. I think that one of the big problems has been that a lot of what we're talking about here requires research software engineers. Now, Glasgow University doesn't have any research software engineers, or it doesn't have a group that is a research software engineering group. Most universities do, but Glasgow is a long way behind the curve on this. And this is true of that for historical reasons, the modelers have often been the software engineers, and then they become, they now, and so their code is locked in this kind of 15-year, 20-year ago era, because they haven't had time to learn any new software engineering skills since then. And I think that what the 2001 FMD outbreak in the UK did was it provided funding for the modeling community to provide standing capacity to deal with issues like the pandemic, or like the 2007 foot mass disease outbreak, or like, bird flu outbreaks and stuff like that. So it provided that core funding to enable that to take off. And I think that what this pandemic may do, if it's properly taken advantage of, is to really push governments to realize that they need to fund the data management and the software engineering side of this as well, because those have always been poor cousins of the modeling community, and so they're always the first things to get cut whenever the budgets drop. And so yeah, it's been bad news in the short term, because there's been a lot of criticism and a lot of ad hominem attacks that have nothing to do with the modeling. But that will put people off anyway. That the last thing they want to do is to be on TV being attacked by some journalist. But I think that it has the potential to be a positive catalyst for change, in that it may push the modeling community to ask for more money for the software engineers, and it may ask, groups like yours to ask for more money for the data managers, and for so on and so forth. So I think it's a kind of two-edged sword. It could really work for us. Fingers crossed.
Okay. Thanks. Thanks for that, Richard. And thanks everyone for coming. Apologies it's run over slightly. Thanks everyone for staying that could manage to stay. Richard, just imagine the lovely round of applause that you're getting. I can give you one here. But yeah, that was really, really interesting, really impressive, and it was really nice to hear it all kind of like laid out. Having lived through some of it with you, it's nice to see it coming to fruition, and seeing people taking it up and being interested in it. Just to let everybody know, this was the last Maurice Block seminar in this session 2020-21, and we're preparing the the next seminar series for 21-22 session. So I'm going to say watch this space, but not this space. Watch the virtual space. I'm sure you'll get an email from Odd about it, and there'll be various things on Teams when it's set up. And I've put in the links in the chat to previous ones. If you want to go back and look at previous ones, you can access them from the IHW website and also from the IHW YouTube channel. So thanks everyone for coming, and hopefully I'll see you at the next Morris Block seminars soon.